Hi, my name is Laura Blue. I'm a nurse practitioner at Duke Hospital. I work specifically in the heart failure area of the Heart Center. I take care of patients who need mechanical circulatory support. One of the major devices that we use is a left ventricular assist device. So I've got that pictured here because my topic today is about how to successfully live as a care partner for a patient who needs a left ventricular assist device. So many of you might come into this role unexpectedly, but you already have skills taking care of somebody with heart failure, so you would need to just add some skills about the left ventricular assist device. Some of you may be listening to this and don't take care of somebody with heart failure, so I want to just outline the left ventricular assist device. When patients have heart failure to the severity that medicines alone can't keep the heart delivering oxygenated blood around the body, we can surgically treat them by implanting a pump adjacent to the heart that can unload that volume and circulate it for the weak muscle part of the heart. The pump is inside the body, but we have electrical and computer wires that come through the skin and attach to a small computer and power sources like batteries on the outside, which you see in this picture. The left ventricular assist device, which I'll call LVAD, is something that can support you, and you can live in the community with this. But most VAD programs ask that patients identify a caregiver, at least one, who can support them as they transition into this new mode of living with artificial pumping mechanisms attached to them. They're attached 24 hours a day, 7 days a week. So patients have to learn to take care of themselves independently. But the transition from hospital to home and home completely independent is different for every patient. And they need some caregiver support more initially, then usually not so much later. But most patients benefit from having a caregiver for some period of time. Depending on how well they do, the caregiving may be longer and more intensive, or very minimal with people who recover and become more active and independent sooner. So what is a care partner? I like to say partner because you do this together. This is the kind of thing that people offer their loved ones, their family members, their friends, to say, I can support you, I can help do some caregiving for you outside of the hospital. The new skills somebody would have to add if they already took care of somebody with heart failure would be taking care of the exit site, so some wound care where the electrical wires pull through the skin and attach to the computer. They have to understand the messaging and response that the computer gives them about what's going on with the pump and the person. And then managing the batteries. They're rechargeable, keeping them fully charged and available at all times. Those kinds of things are the main new skills that a person would learn being involved with taking care of a patient with an LVAD. So I think the biggest thing that I want you to know is that if you decide to take this on, then know you're not alone. There are at least 6 million other people out there in the world taking part in the home care of patients with advanced heart failure and living with a VAD. So this is something that's quite doable. You don't have to do it all by yourself. And today I want to talk to you about that and how to be successful with that, because you can have a huge benefit for that person by being this person for them and helping them through this stage. and organizing caregiving for them. So that's really a great partnership, and I want you to be able to do it successfully. And so the biggest thing we need to do is help you figure this out and sort it out so that you can be the best you can be at this. So initially, when it becomes apparent that your friend or loved one needs to get an LVAD, you have to take stock of your current state and the state of the family and other people who might be available to help them. Because you have to start making some lists. You have to figure out how to add this new task to all the responsibilities you already have. As you begin to make lists of things you already do, whether that's childcare, finances, groceries, pet care, whatever it is, there's a list of a full life that you already have. How do you make this work into that? Making lists, starting to plan, and organize your thoughts to solve this problem of how to add this to an already full life. Your daily routine matters. You've worked on it for years, and maybe it's successful in every way possible for you. Now, how do we alter it and keep it successful for you to add in some things? So being clear about this and breaking down the new task into small portions may give you some help to avoid being overwhelmed or depressed, because it can be tough, but you can do it as long as you have a few tips to help you going. This is the first tip. Be honest with yourself about what you're capable of taking on, because not everybody has one caregiver. Many people have a whole community, and I say a patchwork quilt, of care partners who help in various ways to get this person transitioned into living independently with their LVAD. So being aware and working on the problem with a positive attitude and some planning can get you through this. Also know that the biggest goal we have in caring for others is to strengthen ourselves. So caregiving can be a way for you to take stock of your own strengths, because you have to be healthy in both your physical, emotional, social, and spiritual health. So in terms of your physical health, you need to stay active, exercise, create hobbies, and ask for activities. Keep those activities that keep you healthy in your routine. They're important to you. Let go of ones that don't help you stay strong. Some activities are just, well, annoying. And if they don't have to be done, let them go. You have to stay physically able to take care of someone else. Nutritionally, you have to take stock and say, what do I need to eat so that I feel energetic and strong? So if your nutrition is not where it needs to be, time to do a self-inventory and make some changes, because you have to work on your own health to be able to help someone else. So you know what the foods are that weaken you and what strengthen you, and if you don't, there are nutritionists and counselors and Jenny Craig and others who are willing to give you some advice on that. So look for ideas and strengthen yourself. The other critical part of physical health is your sleep. And many caregivers sacrifice sleep sometimes. And there are many reasons for that, but you have to keep your sleep schedule workable for you. So figure out your new sleep plan. Maybe you get up an hour earlier, but you go to bed an hour earlier. If you can't fall asleep quickly, There may be aids and advice on how to do that, but the other key is let everybody know your sleep schedule, and they can respect those limits and give you time to sleep and not interrupt you if you let them know what you've changed your pattern to or what your pattern has been and you're keeping it. So just tips to keep your physical strength. Get those habits that keep you active, because motion helps you stay positive. For your emotional health, I think you have to keep assessing how you're feeling, because you must have relaxation. You have to find healthy diversions for yourself when the pain or the stress of someone else suffering or struggling can be overwhelming. You have to give yourself permission, and you have to structure that in your day so that you have this ability to recharge yourself emotionally by relaxing and letting go of these emotions. Sometimes the activity, physical activity, is a help in this area, but if you're not sure and need help with your emotional health, then call your clinicians, talk to them, because they are there to help you stay strong and rejuvenate so you can continue to offer care. Take time for yourself. You are the most important part of this equation. You have to be strong because you want to do this and be available to do this care for someone else that you love. Next is your social health. You have to keep checking yourself when you've got caregiver responsibilities. Am I balancing my time alone, my solitude, with social interactions? Am I staying in touch with my friends? Am I maintaining church activities or community responsibilities, things that I want to do that are good for me? You have to take that balance. Having big parties with family, spending time with the kids, with grandkids, they're all in there. If you have trouble structuring that in your schedule and holding it in your schedule, you have to get some help and suggestions and get some support. If the thing doesn't make you smile or give you joy, then maybe it's a social thing you need to turn down. It's okay to say no. You don't have to do everything. Delegate some things that don't enrich you. And then spiritually, you need to set aside time for spiritually uplifting practices. Sometimes that's a cup of coffee in your garden in the morning. Sometimes that's family and friends gathering together to just laugh and have a good time. For other people, it's absolutely their church family and their higher power connection in whatever way that is meaningful for them. But your soul must be nourished. Your spirit has to thrive so that you can stay positive and energetic to give to someone else, because you are so full yourself with positive energy and spirit. So make time for social and spiritual connections and keep that balance of social and private time and solitude and reflection, yoga, meditation, whatever it is. Find those things. And if you can't think of them, ask friends. Look at other successful people. Use other people to enrich you, because it will also help them. So make time for those interactions. And then, what resources are available to you? For VAD patients specifically, there's a wonderful website developed in a collaboration with clinicians and patients called mylvad.com. And that's a platform where you can easily engage if you have access to a computer or a smartphone, and you can get in touch with other people who share your burden. And you get so many successful strategies that other people who've been dealing with an LVAD for many years have come to accept as, oh yeah, But until you know, you don't know. So other people are experts because they have experience, not because they have a PhD. They have experience living life with a VAD and can give you big clues. Local medical team are endless resources. These are people who decided caregiving was for them or care partnering was for them when they decided how they were going to live their life and make a living. So they want to help you. Reach out to them. Tell them where you need support. And then there are local support organizations and regional groups and professional groups. Physical therapists, when they're in the home working with your family, it's a great time to ask them questions. Nutritionists, ask them. Your social workers, your pastor, they're all there to give you advice and assistance because this is really what you want to do. Use your resources. And you can do this and work it into your life. And I promise you, it will add value to your life. Because I want to thank you for listening to this and thinking about taking on this role, because caregiving people that you love is probably the greatest gift you can ever get or receive or give. Thank you so much for your time.